Dr. Freud, welcome.
Thank you, Kaveh. It's a pleasure to be with you. Thanks for the invitation.
Thank you for your time. We seriously do appreciate you devoting some time to this interview, especially at this time of a need. So give us a lowdown. What is the interaction of the brain and the spinal cord and the whole neurology part of this, so we can dive in to other subjects afterwards?
I think where we can start as far as what interests chiropractors is how motion is related to the nervous system, and more particular joint motion of the spine, even alignment of the spine when we talk about posture, for example. And there's different ways to consider the interaction between the body or the joints of the body and the brain or the central nervous system. One is to see or to talk about what effect does motion have on the brain and the nervous system. The other is to say, well, what effect does the brain and nervous system have on the muscular system and on the motion of the body? So when we talk about motion of the spine, for example, which is what interests chiropractors, we are trained to locate areas of the body that don't move, right? Particularly of the spine. And our interest in that is neurological. Well, we can say there's two factors. There's a mechanical factor that interests us as far as adhesions that may form from lack of motion, degeneration that may occur from lack of motion. But where it gets really interesting, I think, is the effect on the nervous system and the brain in particular. On the flip side of that, like I was saying, we could talk about, well, if we understand how the brain functions and its impact on the body and on the musculoskeletal system, we can analyze or examine the brain to have better functioning in the body as well. If you see somebody walking down the street towards you and they have an obvious posture of someone who's had a stroke, for example, you're not going to say, gee, I wonder what kind of problem he has in his elbow or in his wrist. You automatically, instinctively say, he has a neurological problem. He has a problem in his brain. So there's two ways to really look at that connection between the brain and the body.
Amazing. So let's battle that whole movement part, because as chiropractor, both of us, we practice in this field, and it is one of the paramounts that we try to make sure that our practice members and their spine are obstruction free and they're moving. So why do we do this? Why do we have to make sure the obstructions are gone? And why do we have to remove so-called the subluxations?
Why we have to do it is, people come to us because of pain, right? That's the number one reason they come to us. And we know that there's an intimate link between lack of movement and what we call nociception. Nociception being the sensation or the transmission of potential harm. So we have receptors in our body that detect the fact that an area is not moving. And of course, that's not a normal scenario. So whenever we have an abnormal movement or a lack of movement in an area, this is a potential threat. This is may cause potential harm to the person. So those signals are transmitted to the nervous system because above all else, the nervous system is there to allow us to survive. It allows us to protect ourselves. So in the case of an area that's not moving and why it may be important to the patient, if we go to the most basic common reason people visit us is for pain relief, we know very simply that if we can return or bring motion back into an area that's not moving, we can reduce that nociception and give a higher probability of pain relief. Now we know that nociception goes far beyond that, because if we're talking about perceived threat or a perceived harm to the body, pain is only one small factor in that whole nociceptive phenomenon. So much before these nociceptive reactions get to the conscious level of the cortex, it actually goes through many other areas of the brain that are actually more involved in protection and in survival than the actual conscious awareness of pain. And this is where it gets interesting with chiropractors who say, well, I'll adjust people sometimes with no pain, and I'll adjust the areas that I have located as being dysfunctional or not moving properly. And even if the person isn't in pain, we still see positive functional outcomes. Their balance is better, they move better, they feel better. So pain is only a small part of that whole nociception that we talk about. The big picture here is that we're removing interferences, if you will, or we're removing areas of the body that can potentially harm the person. And the nervous system can only benefit from that.
Now, there has been much studies done when it comes to heart rate variability. And I don't know if I remember the research correctly, that there is well-documented research that they show pre-adjustment and post-adjustments. If you can give us some of your knowledge and wisdom about that, that would be awesome too.
That's a great example of how nociception affects the nervous system without creating any pain sensation, because heart rate variability, and if we can talk about cardiovascular system in general, digestive system in general, let's talk about our most basic vital functions. You know, our breathing, the fact that our heart beats, the fact that we can digest food. These are our basic functions, or our visceral functions, our vital functions. Those are all controlled by the brainstem, right? And the brainstem is essentially just an extension of the spinal cord. And the spinal cord, when we talk about, you know, nociception being perceived by the CNS, these are reflexes. At the spinal cord level, if an area is not moving well, we have a reflex that will cause a muscle contraction to protect that area that's not moving. Well, in the same way we have these reflexes at the spinal cord, we have them at the brainstem as well. Now, because we've gone higher up in the neuraxis of our central nervous system, we still have reflexes at the brainstem level, except they become a little more complex. So heart rate variability, breathing in general, blood pressure, digestion, all of these are controlled by the brainstem. So if the person is in a nociceptive state, if the nervous system has perceived a potential for harm, it will signal these brainstem areas, because not knowing what's going on. So we've clipped off the cortex. I don't know what's going on, but I'm in a nociceptive state. I will have a reflex to protect myself by increasing my heart rate, increasing my breathing, slowing down my digestion because it's not important at the time, in order for me to survive. So we can measure things like heart rate variability. We can measure things like respiration. You know, we don't even need the high technology. We can just take a person's pulse. We can monitor their respiration rate. We can take their blood pressure, and that gives us an intimate link, intimate insight into the function of their brainstem and if they're in a nociceptive state or not. What's beautiful about chiropractic and the HRV studies that you're citing is we can do pre and post checks very, very simply. We can take somebody's blood pressure, adjust them, and then take their blood pressure again right after. And we can have an idea if our intervention had an impact on their brainstem just through that mechanism. Now, to be fair, we know that there's a therapeutic quality to interacting with the patient, having them hear our soothing voice, having them lie down on our table and meet our wonderful receptionist. So we do have to take into account the entire clinical encounter to be able to say, well, this is what happened to this patient. So we can't, from a pure scientific point of view, we can't say, well, it's the adjustment that caused the reduction in blood pressure. And that's where science comes in. And that's why science is important, because we can tease out all these different variables as best as we can to get a clear answer.
To be honest, I have done that with my patients. Before they lay down for the adjustment on the table, I take their blood pressure, my own experience. After I have done the adjustments, once they sit up, I take the blood pressure again. And always the systolic and diastolic, both of them are much lower. Now, how much lower? It depends from a patient to patient, but lower from the time that they had laid down.
Yeah.
So to be honest, that whole entering the clinic and stuff could be a reason, but they're already sitting on my table when I take their blood pressure. So if it's supposed to be lower, it would be lowest at that point
Yeah.
before the adjustment. So now, neuroplasticity. There has been much discussion about neuroplasticity. What's your take about neuroplasticity?
Neuroplasticity is essentially how the nervous system can change depending on different stimulations that it may receive. It can also change based on injury. So the nervous system, again, its bottom line is it's there to help you survive. It's there to protect you. So if you have a stroke, for example, where you literally have the loss of neurons, the nervous system is able to rewire itself in a sense to try to take over the functions that it has lost. So neuroplasticity, where it's interesting for chiropractors, is if you can measure a change in a person, as we were saying, before and after a treatment. So take your example of taking blood pressure pre and post, and you see an improvement. It's interesting then to track that patient. So next time they come in, you take their blood pressure again. Did the blood pressure go back to where it was before you adjusted them the week before, or have they maintained it? And it's over time that we can see that. You can also do, to come more into the musculoskeletal realm, which is what we're most, concerned with. Do a simple balance test on a patient. Do a Romberg's test on a patient, pre and post, and see if their balance improves from the adjustment or from your encounter. And then test it again next time, and test it again next time. And if you can see over time that, boy, whereas a month ago, this person could barely stand with their eyes closed and their feet together, they're now solid as a rock. And they haven't done anything else but get adjusted. So that would be a sign of neuroplasticity. There's been an actual change in the way that their brain controls their balance, or the orchestra of contracting muscles here and there in order to keep the person stable. And what I tell my patients about neuroplasticity, and this is considered the biggest discovery in modern neurology, right? This is fantastic. We used to think that, well, of course the brain changes as we grow older. A baby's brain will change, they acquire new abilities, but an old dog can learn new tricks. and we see that through the neuroplasticity. I tell my patients it's like a muscle. You exercise a muscle, it will get more efficient. Not only will it get more efficient, but it will literally change in structure. It will get bigger, right? From a neurological point of view, if you stimulate a circuit, whether it's through an adjustment, whether it's through an exercise, whether it's through a new way of thinking, you're going to strengthen different pathways to become more efficient, and they will literally change in structure. This is where it gets really exciting, is we know that when a neuron gets stimulated or a nerve pathway gets stimulated, it literally becomes, it arborizes. We have dendrites that literally grow to reach out and make new connections with other neurons. It's very exciting. The flip side of neuroplasticity is if you don't use it,
you lose it.
You lose it, right? So again, like a muscle, if you don't exercise your muscle, it's going to become less efficient, and it's going to change in structure as well, making it harder to regain that original function.
Now, while we are on the neuroplasticity subject, I know you have a background in psychology. What is the connection between psychology and neuroplasticity? So what we think and our thoughts and neuroplasticity.
I thought you were going to ask me a Freud question. If you want to lay down, we can go deep. We can talk about your mother, your dream.
Yeah, maybe we'll leave that one out.
So That's a really interesting question. When you look at the evolution of the brain, which is an interesting way to understand how the brain functions, before, let's say, when we can go way back to the jellyfish in the sea, and then the coming out of the ocean, and the reptiles, and et cetera, et cetera. But to think of evolution in a sense that there was a time where there were no emotions in the evolution of the nervous system, right?
Mm-hmm.
There were creatures, multicellular organisms that had nervous systems that could move, that could interact with their environment, but they didn't have emotions. The circuitry just hadn't evolved yet. But when we look over millions of years, how these species then developed new circuits, they basically built those circuits on top of the already existing circuits that allowed movement. So movement and psychology are intimately linked. We talk about emotion.
Oh, wow.
Right. So you can't have an emotion. You look at actors, or you look at a picture of somebody's face. You can tell if they're happy or sad based on their muscular tone on different muscles in their face, right? Facial expression. Right. If you're angry, if you're depressed, not only will it show in your face, it's going to show in your body. You look at these fantastic actors who really know how to, react in a confident posture or a very, subdued, depressed posture. These are emotional manifestations in a physical nature. How can you have an emotion without having a muscle contraction somewhere in your body? It's emotion. Really. It's emotion, right? So yes, there's an intimate link, and we understand it better through evolutionary neurology, and we understand it also by understanding this connection with limbic centers or different emotional centers and circuits in the brain, and how they react or how they connect to the body.
Amazing. So that's the main reason why they say with exercise and movement, neurotransmitters are secreted in the brain that makes you feel better, makes you more happy, makes you more present, I should say.
Absolutely. No one can deny that they feel better after exercising, unless they're exercising incorrectly. You should feel better after exercising, much like people feel better after getting adjusted. That's a neurological phenomenon. Feeling better is a neurological phenomenon. So of course we have an impact on the brain by doing adjustments. It also gets interesting if you continue this evolutionary story and say, well, we have the brainstem, we have these basic movement parameters. From there we evolved to have emotions, and from there we evolved to have thought and cognition. And it's interesting how exercise, it's not an uncommon thing to say, I went for a walk and the answer came to me. Right? Yes. And I think it's Einstein who had he had a walking path around his house, and he said whenever he'd get stuck on a problem, he would just get up off his desk, take a walk, and keep walking until the answer came to him, and he would go back to work. So again, this potential impact that we can have on people's emotional state, on their cognitive state, their clarity in thinking, it gets really, really exciting, and we're really at the brink. We're at the starting point in research to help us understand these mechanisms better, even though they're observed on a day-to-day basis by the average chiropractor.
It's amazing that you hear all these talks about goal setting, mindset, and being present and understanding your higher self and trying to elevate yourself to a higher self, how it has effect on our neurology and on our brains, which is easily explained with what you just said about the evolution and how the whole system is built on top of each other. So they're very interconnected.
Of course. And that, that's another thing that we're understanding more and more, is how the brain is interconnected. Like it takes all your sensory information, It takes your memories. It takes your general emotional states. It takes your intelligence, your sense of ethics, and it creates your own reality. You know, your brain actually creates your reality. And one of the most liberating things about neuroplasticity is that because the nervous system is changeable, you can change your reality. So it really comes into what you're saying as far as, you know, things like meditation, things like, you know, goal setting and all these other things that are more cognitive in nature, literally change how you see things. You know, you don't, it's not your eyes that see things.
True.
Your eyes are just receptors, right? What you see is what gets processed in your brain, right? And that gets combined to a whole bunch of other things that allow you to see the world the way your brain does, and it allows you to see yourself the way that your brain is constructed as well.
That just fascinates me, to be honest. It's amazing how your perception of the world will change if you change your perception.
Yeah, it's fantastic, and change is immediate. That's another beautiful thing about neuroplasticity, you know, and you've probably seen these kind of visual illusions. There's a famous one of the duck and the rabbit. You know, you look at it one way and you see a duck, and then you kind of look at it another way and you see a rabbit. It's immediate. Your perception can change very easily, and you know, if you look at it and you say, well, I only see a duck, and then someone comes around and say, no, see, look, here's the rabbit, there's the eye, there's the ear. Ah, now I see the rabbit. You've changed their neurology in that moment.
Mm-hmm.
And I don't know if you, you know, this is one of the joys of being in practice, is not only do we get to adjust people and have an impact on the nervous system in that way, but we get to interact with them. Like we you know, it's not a silent art that we're performing. We're discussing, we're talking, and sometimes, you know, you can just say a simple sentence, or you can say a simple story to a patient, and it can have a dramatic influence on how they see things. And you say, ah, gee, I never thought of it that way, you know, and it's a wonderful thing. It's a wonderful thing. That's one of the joys about being, you know, a chiropractor. We've got the most wonderful job in the world, right?
We truly are blessed, that for sure. And it has a lot to do with energy too. Generally speaking, I mean, I'm sure our viewers and listeners have had places, situations where they go in and they feel energized. They just feel full of energy. And opposite to that, I'm sure they have gone places and met people who they say it just sucks their energy right out. They feel so tired.
Yeah.
So that has a lot to do, again, with the perception, how the brain perceives it, and how our body basically interacts with all the perception. Now, Dr. Freud, you opened up so much question in my head. This whole interview gonna be taken by it, but I know time is limited. So let's go back to the receptors in the spine. We know they are essential for our brain to interpret us in space, and essential for our brain to basically do the appropriate necessary mechanism in order to bring about regeneration.
Yes.
So the degeneration would be basically the opposite of regeneration.
Sure. Yeah. So you can look at movement on a spectrum. You can look at it from, you know, no movement at all, and the neurological consequences of that. And we could look at good, proper movement and alignment, and how that affects these receptors that you're talking about, and the ultimate effect on the nervous system from that. We can use an analogy to better understand the receptors, and it actually comes back to your comment about energy. If you look at a windmill as an example, so a windmill generates electricity, but we know that there's a spectrum as to how much electricity it can generate. So the first consideration is its position. So depending on where you place the windmill, you will have more or less of an effect on generating electricity. If you put a windmill between two buildings, that's not a very good place to put a windmill. Whereas if you put it out in the field, its positioning will allow greater chance of stimulating electricity. In the same way that we look at mechanoreceptors of the spine, for example, if I have a head forward posture, I know that there are receptors. If you think of the three dimensions of a spine or of two vertebrae, I know that if they're aligned the way that they're designed to be aligned, I will have the maximum amount of mechanoreceptor stimulation from gravity, just plain from gravity, pushing down on these receptors. Whereas if I have a misalignment, or let's say a poor posture of some sort, I now have a whole area of receptors that are no longer being stimulated from gravity. So position is number one. The second thing obviously is movement. So the windmill needs to move in order for it to generate electricity, in the same way that our joints need to move to stretch muscles and other tissues in order to generate stimulation in those mechanoreceptors as well. Where it gets interesting for the energy aspect is that all of these receptors together feed into the brain. The brain processes this and helps us maintain energy, or it acts as a generator, really. You know, it's an interesting phenomenon when you think of, okay, what is energy and how does it relate to the body? You look at somebody who exercises, who's a top athlete, and they're always out there, you know, exercising, and you think to yourself, my God, they're expending so much energy. They must be really tired. They must be constantly fatigued. But it's the exact opposite. These are the people that you look at them and they're bright-eyed and they're with it, right? And you look at the other side of the coin. You look at somebody who doesn't exercise at all, who's a couch potato. And you'd think to yourself, well, from energy mechanisms, if you look at the physics of that, you would think they're doing a great job at conserving their energy. They must be, you know, they must have tons of energy. But it's the exact opposite. These are the people who are always fatigued and tired and depressed, right?
That is key for this whole notion of, sorry to cut you, but this is huge. This is to explain why sitting and being dormant and basically not doing activities, it just has a snowball effect on how you feel.
Absolutely. Absolutely. And that's the beauty of exercise, as being, you know, perhaps the most important factor to stimulate the brain, to keep your brain healthy. I mean, there's no amount of Sudoku puzzles that you can do that's going to be better than exercising, right? And chiropractic as being an art form that improves movement, and not only improves movement, but brings movement where there was lack of movement before, has a tremendous impact on the nervous system, just by considering the mechanoreceptor aspects of a joint adjustment.
Dr. Freud, I wish I could continue this conversation for hours and hours. I know we haven't even scratched the surface, and there is much to be discussed.
Yeah.
So, obviously, we're in some very difficult time that we all, as a community, as a nation, we are going through. Nerves are high, stress is extremely high. People are losing their jobs, livelihood, and it's causing much unneeded stress to their body, to their nervous system, ultimately to their family and the community. What are your suggestions that we could try to practice in order to reduce stress and our perception of stress, so our body could handle it better?
I think in the context of our discussion, one of the most important things is to move, is to exercise. You know, it's it's interesting to hear people kind of joke as to the things that they say they never got around to doing because they didn't have the time, right? Oh, I don't exercise. That's the classic answer. I can't exercise. I don't have the time. And now we've been given this gift of time. And it's interesting to see people kind of joke and say, I'm not exercising any more than I was when I didn't have that time. So I think exercising, moving is crucial. The less you move, the more you're going to be prone to being depressed, the more you're going to be prone to, getting sucked into social media and the news. And although I'm not saying, you don't want to stay informed and be realistic of the situation, you don't have to become obsessed with it either. So movement, if you're in a part of the world where you're allowed to go outside, even better, get some fresh air. There's clear research suggesting that, running outside is much better than running on a treadmill, for example. Although you can't physically connect with people, you can physically connect with nature. You can garden, you can clean your yard, but I think movement is one of the key things. If you can't go outside, exercise inside. There's just do some push-ups, do some sit-ups, get online, go on YouTube, get an exercise program and do it every morning. Change it up, do some yoga, but move, and you move alone. And move with others. If you're fortunate enough to be, quarantined with your family, what a beautiful time to connect with them and connect in a physical way as well. Go for a bike ride, go for a walk together, do some movement. Like we said, it's probably one of the best things for the brain. So take advantage of it and take advantage of the time that you have. I also had a beautiful, a video that was sent to me by a friend that I posted on my Facebook page from a teacher in China, 7 weeks in to their quarantine, basically giving the rest of the world advice. And it's a most beautiful thing. It's about a minute and a half long, and I encourage you to go check it out. And
I actually did. I did. I know what you're talking about. Yes. Yeah. It's the most beautiful thing. Correct.
It's a beautiful thing, and it's straight to the point, and it's words of wisdom, and it's from beyond, right? It's someone who's been there, and we're not there yet. And part of the fear and the anxiety that we're living through is the fear of the unknown. It's the unpredictability. The brain loves prediction because it provides safety, right? If you know what's coming next, you're safe. So this is a very uncertain time, and we're going to get through it. We're going to get through it, and we just have to adapt. If there's one thing that humans are great at doing, it's adapting.
It's adaptation. I mean, our species, as in general, we have numerous of these threats. We just have to be careful, follow the guidelines, listen to the authority. Don't overload your system with just information come from all sides. Make appropriate choices for yourself and your family, and just enjoy the time if you can. Now, Dr. Freud, if our listeners and viewers want to get a hold of you, where do they find you? Give us your website address and any sort of a connection that they may be able to get you at.
For chiropractors, the best place to see what I do, what I teach, is on my website, Adjusting the Brain. So www.adjustingthebrain.com. They can reach me through there, or send me an email, patrickfreud@adjustingthebrain.com. My clinic, if you want to see, where my clinic is and what I'm about, it's freudclinic.ca or clinicfreud.ca in French, and that's my info.
Perfect. Dr. Patrick Freud, I am genuinely grateful for you devoting this time for the interview. There are many subjects that we didn't dive into, and I would wish and I hope that you would agree to come back so we can dive into the other subjects in some other date.
Yeah, I'd love to, Kaveh. Thank you again for the invitation. It was a lot of fun.
Thank you so very much. You have a great day, sir.
Thank you very much. You too. Be well.
Stay safe. You too.
Take care.